As the novel COVID-19 coronavirus continued to spread in early 2020, it became apparent to leaders around the world that vaccines against this pandemic were needed, which resulted in numerous accelerated development efforts. Some were touting vaccines would alone allow society to return to normal without the need for any more social distancing and face mask wearing. In June of 2020, the FDA set 50% or greater as the target vaccine efficacy level, but it was still unclear what would be needed to indeed return to normal. It was clear that decision makers could benefit from benchmarks to aim for when developing and testing vaccine candidates. Since 2007, our FICOR team has used computer modeling to help respond to nearly every major infectious disease threat to the United States. For example, during the 2009 H1N1 flu pandemic,
the Centers for Disease Control says H1N1 has spread to 46 states.
It's a new virus. It's actually a new virus combination.
Breaking news this morning that the CDC has confirmed that the first American death has occurred from swine flu.
Our team was embedded in the U.S. Department of Health and Human Services to help with the national response. And now, our team is using computer modeling to help combat the COVID-19 pandemic. For example, we built a model for a study published in the American Journal of Preventive Medicine that won Paper of the Year in 2020. Our computer model simulated the entire U.S. population and ran scenarios with various vaccine efficacies and percentages of who got the vaccine. Eventually, a version of this model was adapted by the New York Times into an interactive tool. We found that during a pandemic, in locations where the COVID-19 coronavirus is already widespread, the vaccines need to have at least 80% efficacy and at least 75% coverage to slow or stop the spread of the virus to the point where you can safely drop precautions like social distancing and mask mandates. For locations where the virus hasn't spread widely yet, at least 80% vaccine efficacy and at least 60% vaccine coverage is needed to prevent a significant outbreak.
This study helped put into context the Pfizer, BioNTech, Moderna, and J&J vaccine efficacy results when they were announced in December 2020 and January 2021. Our study demonstrated why, in the meantime, other precautions such as social distancing and mask use should be maintained. Given the glitchy rollout, variants, and vaccine hesitancy, achieving upwards of 75% coverage won't happen quickly. Therefore, additional precautions are necessary to control the spread.